so much. Thank you so much, Mary, for organizing this wonderful seminar series. I learned a lot, and I'm happy to participate, and of course as well to present. And I find it really nice way we can meet here and discuss issues we were used to discuss in person. So, but let's go to my presentation today. I'm presenting you our research, which is not finalized yet, but which is done within the research grant provided by Latvian state, where we do research on COVID-related legal issues in healthcare. And our part is very small. We do just legal issues in healthcare system. And public health in Latvia, but of course, Latvia being an EU member state has something to do with EU law as well. And I was very happy to add the EU law part to our research. We are doing this research together with my doctoral student, Laura Kadile, and she's present and she will also take part in this presentation later on. So yeah, happy to do together. And but of course, let's go further on. On the topic, it's our topic is patient rights, cross-border patient rights, and why we decided to add EU law to our study. It was due to our practical experience, as you know, and those who don't. I'm practicing lawyer as well, and I do receive different questions from clients regarding application of law, not only academical part. And the questions I received from clients in Latvia during COVID pandemics were following, as I mentioned here. They were like related, they were all cross-border patients who turned to me, and they were asking if I develop symptoms, where do I get testing in Latvia? If I'm diagnosed with COVID, how do I get treatment in Latvia? And what happens if I'm still like I'm recovering from COVID? How do I get back to society? And then I had also some more particular questions. For example, I had a client who is receiving antiretroviral therapies in other member state, and he was running out of these therapies in Latvia, and he was very concerned how to get his state compensated medicines in Latvia. And the same as there were such Latvian patients who were locked into other member states, and they had a question how they could get their medication they have to use, and etc. And of course, then there we also touched up on the issue, and it was personally to me very important because I had to travel to Azerbaijan because I'm a member of the Committee of Prevention of Torture. And I had to travel in December from Riga to Amsterdam, to Istanbul, to Baku, and back via Munich. And then, of course, that was concern. What happens to me if I'm developing COVID symptoms while I'm traveling? Where do I get care, on what conditions, and so on? So that made me as well to look what kind of rights I would have in member states. And outside the EU as well, because I was traveling outside. So that made us think how do we do it? How do we apply that law? We are well aware in respect to books, because that we are quite well aware that in books we have quite good legal norms. So before that, when we developed this study. And we really looked much more. Our aim is to look how well or how poorly we can exercise our rights ourselves and in general. And for that, we applied not only legal research methods, but we applied as well empirical research. And we looked, we collected materials, policy materials, and information materials for our research. So we will later on we will present what we collected and what results we got in this. So my part is here, legal part. Of course, we are well aware that our rights are based on law, and in respect to EU law, rights are based on primary law, first of all, and then secondary law additionally. In respect to cross-border patients during pandemics, there are two particular articles of the treaty I would like to point out. It is, first of all, Article 45, freedom of movement for all workers, shall be secure within European Union, and such freedom of movement shall entail the abolition of any discrimination. And third, a third part of this article says that there could be limitations to these freedoms justified on grounds of public health. And the pandemics, of course, is definitely the issue of public health. So the treaty as well already provides some provisions in respect to restrictions when public health is an important reason for justification. Further on, another article of the treaty we are well aware of is Article 168, which is like bread for health lawyers in EU, so which we are quite well aware, and I will not quote these lines. I'm sure you are well aware, and you have been working with that for years. So coordination and improvement, but of course limited competence of EU. And then, of course, we have as well a Charter of Fundamental Rights of EU, which states the Article 15, freedom to seek employment and work and to exercise the rights of establishment, and in pandemics as well. Then Article 20, everyone is equal before the law, equality among citizens of member states, non-discrimination. And Article 35 is article stating that everyone has the right of access to preventive health care, and this is pandemics. Preventive healthcare is a matter of pandemics, and right to benefit from medical treatment. COVID patients, citizens who are suffering from COVID, they have a right to benefit from COVID treatment. So that is stated in the fundamental Charter of Fundamental Rights. So this is what it concerns primary law. Secondary law applicable to issues we are discussing today are there are several directives and regulations. Like, first of all, of course, we are looking at Directive 211/24 on the application of patient rights in cross-border healthcare. And as we discussed in previous series, regulation on the coordination of social security systems in respect to payments for cross-border patient rights. And additionally, when it comes to healthcare, of course, we have to very much rely on national regulations, both in respect to healthcare rights and both in respect to national regulations stating restrictions due to pandemics. Emergency regulations, special public health measures, they are usually this is national law. And when we look at this, it can be very different from country to country. So, and then we have to put these, here are 4 pieces together, and I will then provide more details. There is one more piece we have to look at. As a patient rights, as you know well, the directive provides rules for facilitating the access to safe and high quality cross-border healthcare. So that's what is needed. When I am traveling in EU, I need possibility to get, I need facilitation to get healthcare. And it's clear that directive apply to the provisions of healthcare to patients. So it's clear stated that this directive states cross-border patient rights. When we look at definition part of the directive, I here mentioned few issues we could discuss more in detail, but I'm not going to do this in this presentation, but I will just put a few lines here. Healthcare is defined, but there is a question about epidemiological safety measures, whether they are healthcare or not, particularly to patients who are requested to undergo COVID testing for traveling, not for disease. It is clear that the definition of cross-border healthcare, what it means, and then as well also the directive provides definition of term patient. And here again, as soon as there are symptoms or positive already COVID analysis, it is clear that such person is a patient. But a cross-border worker who is requested to do COVID testing, it's a very good question whether he is patient or not. And I would argue that yes, he is. But I might believe that there are lawyers who would say, no, he's not patient because he's not in need of healthcare. So there could be discussions in respect to application of definition. And then as well, what it concerns chronic patients, then we also we realized that there is issue about prescriptions, how chronic patients could get their medicine. And medicine, of course, is a matter of prescription. Access to medicine, especially like in my case, antiretroviral therapies are directly related whether there is a proper prescription in the meaning of a directive or not. So then Article number 4 directive, what is clear, cross-border healthcare is provided according with legislation of the member state of treatment. So when we look at COVID testing, there are a lot of discussions which kind of tests are good enough. Clearly, the member state of treatment of testing is then to decide either saliva test or PCR or other tests are good enough for COVID testing. And then, of course, there is a question about standards and guidelines in COVID treatment. This was my interest when I had to decide on respect to traveling. If I will get sick with COVID in Germany, what kind of treatment I might get there. But that's again, it's according to national guidelines and standards. Then, but how do I get to that treatment? And then it's, of course, directive is quite clear because the directive clearly states that the member state of treatment shall ensure that patients receive from the National Contact Point relevant information. So I'm supposed to receive relevant information from the contact point of the country where I am seeking for healthcare as a cross-border patient. And Article 6 provides that the national contact point in the member state of treatment shall provide the patients with information. Clearly, legally stated where I would get information about COVID treatments or COVID testing if I would need one. And Laura will tell what is reality in this respect. So, and another one, secondary law, which is really interesting and important in our case here, it's about free movement. Free movement, Article 45 further on is regulated by the Directive 2004/38 in respect to right of citizens to move and reside freely. And there is Article 29 clearly providing further regulation in respect to public health measures permitted and justified for restriction of these rights. And here is clearly already before the pandemic stated that principally if there is disease which is epidemic or with even epidemic potential defined by World Health Organization, and then the member state can require persons entitled to the right of residence to undergo, free of charge, a medical examination to certify that they are not suffering from any of these conditions. So, and this is a legal basis for testing, for requirements to test on borders, for border crossing in EU. But please look at the law, which says that it's free of charge. And what I already experienced, my traveling to Amsterdam was not free of charge in this respect. I was asked to present a COVID test, which I paid myself, and later on, Council of Europe reimbursed. So then we could look at EU policy, but this is shortly I will introduce EU policy. There are few issues and not so much on patient rights. Unfortunately, there is emergency support instrument developed. There is a lot of comparable a lot of safe and effective vaccination, but not so much on cross-border rights. There is one targeted policy document targeting patient rights. It is issued by the European Commission on April 3rd, which is providing clarity on reimbursement and providing clarity on arrangements for patient mobility across borders. And here I just, you can see the document here, I just listed what this document, this commission, what commission states in respect to cross-border patients. I will not read all this. This document is available for everyone. But what I would like to say that in respect to healthcare arrangements for cross-border patients, Commission made clear that in respect to prescriptions, there are quite big limits within EU because e-prescriptions are only available for few states. And still there is, the Commission recommended that patients should receive a copy of their medical records, but what I noticed like last week, still, if you would like to receive your COVID test in English in Latvia, you have to pay additionally. And then I would also say that the Commission advised member states to take additional steps to ensure continuity of care, for example, it was this HIV patients' cases. And then Commission advised that the general principle of the mutual recognition of prescriptions should be applied. And the Commission advised that the national contact points on cross-border healthcare can provide general information for cross-border patients. And as it was COVID-related guidance, and of course on COVID-related issues. So that's April 2020. That's quite long ago. And our empirical part will present you the situation, how far these guidelines have been implemented today. And another issue in application of these rights you can find in a Commission documents. There is, of course, a special institutional body for cross-border healthcare, and this called Cross-Border Healthcare Expert Group. And they met last time in November, and then they issued this full statement in respect to cross-border patient rights. And I would really say that they not so much said there, and not so much interest in that issue we are like presenting here, because what they say here that they are mainly focusing on purchase and transport of medical equipment and transport of staff and medical teams across borders for COVID patients, but not so much interest in how one regular patient does when he stays in another member state. So this is how far in application we could like see traces what is done in the level of EU institutions. In respect to national contact points, so it is clear that regulation states that the national contact point shall provide information to patients concerning healthcare providers, and in guidelines it is stated as well that national contact points should be the right institutions to prepare information in COVID and also to provide. So, and here I have to hand over my presentation to Laura, and she will now present you how national contact points are doing it now at this moment with complying with law, with directive, with requirements stated by the directive in respect to functions of the national contact points. Please, Laura.
Thank you, Solvita. First of all, I want to thank Mary for having us today. It's a pleasure for me, as one of the youngest researchers in Latvia, to take part in this discussion. And I will continue my part of the research with the information that we have gathered after we looked at the list of websites of National Contact Point for cross-border healthcare of the EU member states published by the European Commission. So the first part of our research includes mostly the information that we have gathered from these websites, what was written in them, and including other links to special websites set up by some countries to combat COVID-19. And the second part of our research included calling to the national points of each of the EU countries for the further information. So we have raised the following research questions. Firstly, in which languages the information is offered? What is not stated about COVID-19 in general? Then more precisely, what information is available to the cross-border patient as to COVID-19 testing? What information is available to the cross-border patient in respect to treatment or response to COVID-19 in case of illness? Are there any barriers? This could be a topic we could discuss later. And last but not least, is there any information for cross-border patients with chronic diseases? Let's look at each of the questions separately. Please, the next slide, Solvita. Firstly, I want to point out and highlight that the list of national contact points for cross-border healthcare in other EU countries have been updated only a few days ago, on the 19th of February this year. If something has not been changed till today, of course, therefore, a priori, I was convinced that the member states would have provided up-to-date information. But unfortunately, we will see that it was only my imagination that has worked well this time as well. So first of all, regarding the language, there is no problem with the possibility to obtain information on websites in another language that the cross-border patient may understand, for example, in English. That's true. In addition, there are separate websites with several sections, the terms of which are translated into English, but their content is not. So the content of these sections is only available in the national language. An example is the website of French National Contact Point, as well as the Spanish National Contact Point. There are websites where the available information is not in English. For example, the website of the National Contact Point in Luxembourg, that was available only in German and French, not in English, but it wasn't a problem for me because I know German pretty well. The Portuguese National Point website is definitely my favorite one. You can see the screenshot of the website in this slide. No text, no information. When reading the website in the original language, yes, specific information is already offered that could be useful. But however, anyone looking for help while in Portugal do not speak the language. So at first glance, it's a very general information that's provided, but unfortunately, it is not available in English. So let's move forward, please. Next slide, Solvita. Let's look at the provided information more precisely. Although some of the websites contain European Commission guidelines and instructions, some of them, especially for the treatment of cross-border patients, there is no indication of where and how a non-resident should proceed. Non-resident should proceed. The information provided on COVID-19 related issues on the websites is general. Information on how, when, and where the test can be passed is provided, as well as a description of the procedure to be followed for a successful test pass process. What else? Indicating how to apply for the transfer of analyses, as well as the procedure for receiving the results. Nevertheless, in most of the websites, the information is not only general, but only available to residents of the country. There is no reference to cross-border patients, for example, the Danish National Contact Point website. However, it should be positively emphasized that contacts such as phone or email are indicated on the website in case the website visitor has not found the necessary information. For example, a positive example is the website of German National Point. A window popped out on the website for the further information. Please call and etc. or just contact per email. Please, the next slide, Solvita. So one of the positive examples is the website of the Finnish National Contact Point. Information provided on the website stipulates that if the person experiences symptoms suggesting coronavirus infection, it's needed to contact with the health center of the municipality in which the person is currently staying. And it's written then in Finland, everyone is entitled to urgent care regardless of their country of origin. And in case the municipality of residence is in Finland, you have a certificate of entitlement to medical care. Or in case you are a traveler, you will receive treatment for COVID-19 for free. And what else? In addition, I wanted to point out the National Board of Health and Welfare in Sweden. And from the information that's gathered on the website, we can see that this board is an important stakeholder in providing support to the health system and social services during the Swedish COVID-19 response. Please, the next slide. Let's have a glance to the barriers which a cross-border patient may face in these circumstances. Yes, of course. Firstly, that's the lack of information. As you could probably notice from the previous slides, websites are not updated. The homepages contains only a few paragraphs. For example, Bulgarian website. The information on the websites does not even contain the word pandemic or COVID-19. For example, Croatian website. From my side, what can I add to this? The role and functionality of such a national health point website is debatable. So that could be for the discussion. So if there is a lack of information, we cannot find out the real barriers at all. And secondly, just shortly, in some of the member states, a cross-border patient can get a free test for COVID-19 if the person firstly has the symptoms and the general practitioner thinks you need to be tested. This is a case, for example, in Ireland or Germany. So how to ensure the rights and provide such a process to a non-resident. This could be a topic for our discussion. And last but not least, the next slide, please, Solvita. Is there any information for cross-border patients with chronic diseases? So most contact point websites, I need to say, do not cover information on the treatment of such patients. Nevertheless, the following countries are positive examples. For example, the Latvian website, general information about the overall system in English is available. In Finland, there's a separate part of the website that's dedicated to the care of chronic patients. And in addition, as well, it is possible to obtain treatment required by a chronic disease by presenting your European health insurance card. And with the card, cross-border patient will pay the same fee as the local residents. One more example that I can add to this just shortly that covers the right to see a general practitioner who can, in these circumstances, prescribe the necessary medicine if there is a need to. Such procedure is specified in Lithuania. So that's shortly all from my side. I will give the floor back to Solvita, please.
Thank you, Lars. Thank you so much for this part. And here's just shortly our preliminary conclusions. Laura, can you please switch off mic?
Yes.
Thank you. So, but we see that European law in books provides legal framework for cross-border patient care. But when we see de facto, there is information is very limited. If you don't have information, of course, your ability to proceed is also limited as well. So, and Finland is really good exception in this picture, with really nicely described the way how the cross-border patient could move. And what we could say preliminary that we see really barriers for provision of cross-border patient care, both by doing our research and by meeting these people I described in my first slide. But we really see that we believe that there are restrictions and there are barriers due to pandemics, due to travel restrictions, and so on. What we will do further, we are going to develop an article and a manuscript on this research, but we will now prepare a written questionnaire and we will send to National Contact Points as well, and let's see what they will respond to us in future. So thank you so much for having us and listening to our research results, and we are very, very much looking forward for your comments, suggestions, questions, critiques, whatever you may help us to develop our research further.
Okay, thank you very much, Solvita and Laura. I'm just stopping the recording now.